Hello, everybody, and thank you for joining us. Today, we will be discussing the field of speech pathology with speech pathologist Danila McAsey. Danila holds a master's degree in speech language pathology from the University of Iowa. Through the years, she has had experience in public school, nursing homes, special populations facilities, hospitals, early intervention, and private practice. She joined Speech and Language Rehabilitation Service as a partner in 1994. In this capacity, she has worked with children and adults. In addition to early intervention, she has a special interest in augmentative communication, working with children with hearing loss and cochlear implants, working with adults with developmental disabilities, adult voice and swallow restoration for adults with head and neck cancer. She has served in multiple capacities with the Peoria Speech, Language, and Hearing Association, including past president. She has also served in several capacities with the Illinois Speech, Language, Hearing Association as VP for Professional Affairs, chairperson of the Representative Council, as well as past president. So welcome, Danila. How are you doing today?
I'm doing well. I appreciate the invitation.
Absolutely. We'd love to have you on here. And you have a long list of credentials that we're excited to dig into and learn more about your profession. So can you tell us a little bit about your field and what brought you into it?
Well, speech and language pathology is a fairly diverse field. Its principal areas of interest are the development of functional communication skills, which includes the development of speech, language skills, which encompasses what you understand and what you can say. And I define saying in a pretty broad way, not only what people are used to in terms of thinking of speech, but also people who use manual sign language and a more recent development over the last 20 or 30 years is electronic communication that gives voice to individuals who would not otherwise be able to speak or use sign language. It covers the entire age span from early intervention. Early intervention covers from birth through 3 years, and as well as school-aged children into adulthood and into the geriatric population. And as we move through the age span, there become different concerns and focuses of attention for the adults. In some cases, speech and language pathologists who work in hospitals, nursing homes, and rehabilitation centers will work extensively with adults who maybe have had strokes or head injury, or are suffering from neurological problems such as ALS, myasthenia gravis, and various forms of dementia. They also include work with swallowing, which most people think is kind of curious. What does a speech therapist have to do with swallowing? Well, it turns out that the equipment, anatomically speaking, that you use for talking is the same equipment that you use for swallowing. So we do receive extensive training in the anatomy and the neural physiology of the speech, hearing, and swallowing mechanism so that we can help people who swallow. Our sister organization is audiologists, and those individuals work with hearing, balance, auditory processing problems, and the fitting of amplification. So as you can see, it's a very broad area of study.
All right, it does sound broad. It sounds like there's so many facets to it. And what exactly drew you into such this complicated but at the same time fulfilling career?
I would say my first experience with helping an individual was when I was in high school. No, 8th grade. I was in 8th grade, and we had our church had a summer program that helped with tutoring children. So I worked with this little boy, tutoring him, and he had quite a bit of difficulty with his reading skills. As I look back now, I figure he probably had a learning disability. But at that point, I just learned how important it was for people to be able to process language and reading, and I found that fascinating. So when I went away to college, I knew what I wanted to be when I grew up. I went straight into speech and language pathology, and as I got into that field, I realized how broad and how fascinating the field is itself.
All right, that sounds cool. That's a really cool way to get into the field. And it's such at a young age that you knew that you knew right away that these are the kind of people you want to help. With you already the next question I was going to ask was the specialties and the subcategories, and you were listing them all off, and it's obviously very extensive. And so I guess the next question to follow up on that, would you be able to explain how to distinguish between the terms speech pathologist and speech therapist, and maybe any other terms that are thrown around with your profession?
Um, Practically speaking, a speech therapist and a speech pathologist are the same thing. In schools, speech pathologists are typically referred to as speech therapists, or more even typically referred to as the speech teacher, even though we do a heck of a lot more than just teaching speech. I mean, even before, well, way before I was born, they had things called elocutionists, which is a pretty fancy word for a person who helps another individual learn how to pronounce things. But speech pathology and speech therapy are really the same sort of thing. In order to practice speech and language pathology, the minimum requirement is a master's degree in speech and language pathology from an accredited school. And then from that point, you continue with lifelong learning and continuing education to develop skills, because I do things now that weren't invented when I was in school. And I'm doing things now that I never imagined that I would be doing when I was in school, because the profession has grown and it has helped me grow.
Okay, and I think going off of the comment about the master's, I know that you and I understand how much education goes into getting a master's, but maybe for the younger viewers, would you be able to explain how long that takes to obtain that master's for the minimum requirement?
Well, you would go through an undergraduate program, usually 4 years. I mean, some people excel and get through in 3, but they would be working darn hard to do that. Then you would go on and apply to a graduate school, which would allow you entry into a master's level program. And depending on your undergraduate background, it could take you anywhere from about 18 months to about 2 years. If you went from, let's say, an English major into speech and language pathology, actually being an English major would hold you in good stead, because you would know really a lot about language and reading. But it would probably take you a little bit longer than if you had taken an undergraduate course of study that had included some of the health sciences. And so you would need to build in some of the prerequisite work.
Okay. And in addition to that, first off, what are some of the good schools in the area that, when I say area, I mean like Illinois, surrounding states, that you think that would be good options for kids that are looking into this?
Okay. Illinois is blessed with a system of higher education that has wonderful schools of speech. It's speech sciences, communication sciences. The University of Illinois, Eastern Illinois, Western Illinois, SIU up in Chicago, Circle, University of Illinois, Circle campus, Northwestern. I mean, they are all amazing schools. I believe I missed some up in the Chicago area. Midwestern University, I think, also does. A few others. In the surrounding areas, really any of the, they used to call them the Big Ten schools, now it's just big. All of the Big Ten schools have excellent programs. University of Indiana, Purdue are excellent programs, Ohio State, University of Wisconsin at Milwaukee, University of Wisconsin at Stevens Point, and at Madison. And I will admit to a little bit of bias, but the best is the University of Iowa in Iowa City, which is where I went. So Missouri also has schools there, University of Missouri, but I'm not sure at what city. So in the surrounding areas, there are quite a number of opportunities in where you can study speech and language pathology and audiology.
All right, so it does sound like we have geographically, we're in a great location for speech pathology.
Absolutely.
With that, since we are in a good geographic for the speech pathology studies, how is it within this area for it being a good financial decision?
It's an excellent financial decision that you can make. Speech pathology is now rated as one of the top 10 professions for people to pursue at this time and into the future, because of the breadth of our study from early intervention through the geriatric population, even as our national population shifts away from younger to older children, there are going to be many opportunities. Most people think that speech therapists are pretty much just in the schools, but from my own experience, I know that I work in early intervention, which is not immediately associated with the school district. There are, besides the public schools, there are rehabilitation centers there, and special rehab centers like Easter Seals would qualify as one of those. On the adult side, they have rehab centers, both inpatient and outpatient with the hospitals. So you have the hospital setting, you have individuals that work in nursing homes, and the VA, the Veterans Administration, has an extensive system of services for vets, and they also employ speech and language pathologists. If you wanted to go to the academic route, it would take more education, a PhD, but then you can go into teaching and I was going to say counseling, but that's not the word I want, supervising. And we, in our practice, I forgot to mention the fact you can also go into private practice and specialize in particular areas. Most private practices have a focus of interest. Depending on where you go, the focus might be voice and adult rehabilitation, might be fluency. This is helping people who stutter. Some private practices focus only on pediatric, and that's defined as anybody under the age of 21. Our private practice, we are a general practice of speech and language pathology, so we work with both children and adults. So, and I would also, I guess I would add to that, you can start in one area, and as your interests and needs change, you can move into a different area. I started as a school therapist and went on to work with special populations and then into private practice. I know a number of individuals who have changed from one location to another, and it just speaks to the kind of flexibility that there is available in speech pathology.
Do you think it is an asset to your patients and to yourself, whether it's for your own learning or for your own patient services, that you are general practice versus being specialized?
The answer to that, I think, really is no. I choose to be a general practitioner because I have a very wide range of interests, and I enjoy working with toddlers as much as I enjoy working with school-age children. as much as I like working with adults with disabilities and with people with head and neck cancer. I just find that variety in my day, in 1 hour, I can be working with a 2-year-old, and in my next hour, I can be working with an individual who maybe has had a laryngectomy, which means usually because of throat cancer, their voice box has been removed. So they are unable to speak in the way that they used to speak. They breathe through a hole in their neck, and they just have to learn a lot of different lifestyle changes, but it's incumbent upon me to help them with issues in swallowing, but also voice restoration. Even though your voice box is gone, you can learn how to talk again. And for me, that's the most important thing, is this individual recognizes, after having such a traumatic diagnosis and a pretty extensive surgical experience, that they will be able to largely return to the life that they had before, and that they will be able to talk. And that's one of the points I really try and drive home to those patients, is that they will be able to communicate again. They will have a voice. And that's one of the things that terrifies people who are in the process of losing their larynx.
And that is very terrifying. I mean, obviously, the only reason I got you on here is because of our daughter Josie. I mean, I'm sure maybe if I reached out, you would have been all for it, but I know it was a little easier because our daughter Josie, you help her with her augmentative device, and she had her voice at 1, and she doesn't remember that as much as we remember that. And I agree that these augmented devices really help the families and the people that are part of them to be able to express themselves more and feel more confident about their selves and what they are expressing.
And indeed, that's true. I mean, there's nothing that makes us more human than our ability to communicate. And if we can bring an individual, and this is what I find fascinating about what I do, is that if I can help a person be able to communicate functionally, to say what they think, what they want, what they feel, what their hopes and aspirations are, I mean, it's just an amazing experience to be able to do that. And it's why I get up every day. It's just a lot of fun, and it's an extremely fulfilling profession to have. As you can tell, from our discussion, that we have moved beyond, what people think of as a speech teacher for school-aged children to areas of communication, which is a much broader subject that not only includes individuals who have lost their voice or who don't have a voice but are learning to use it, but it also includes an area of practice that is relatively new now. Speech pathology has always dealt with voice, and usually it has been in the case of people who maybe are chronically hoarse because they have misused or abused their voice. But there is also an area of practice within the LGBTQ community where you are changing, you are beginning to match your gender identity. And if you are shifting from male to female or female to male, there are things that you would want to be able to learn to do to adjust your presentation to match your gender identity. And that would be how you use your voice and the way that you present yourself. And speech and language pathologists do that as well.
And that's so fascinating. I think that is something that I wasn't aware of, and I hope that other people can even just know that that's an option.
Mhm.
As we come to the close of our discussion, I do want to ask you, what are the most important things that you think that you should get across about your profession?
I would say the key element is your desire to help people. I don't know a single speech and language pathologist that doesn't have a passion for what they do. And I think that's a critical feeling to have about anything that you pursue, whether it's speech pathology or anything else. If you can have a passion about what you do, it's never work. It's always a joy. I think having a passion for that, I think the idea of enjoying lifelong learning, things that I'm doing now were never even invented when I went to school. And having an interest in lifelong learning and finding broad areas of interest. Even now when I do continuing education, I don't just stick to the areas that I am directly involved in. Because I can always find something that would be of interest to me and maybe applies to what I'm doing now, or may be helpful or interesting to me in the future. So I think you have to have a passion for what you do. And it's easy to have a passion when you help give people voice and help them to be able to communicate and grow and be able to show the world who they really are. And that's exhilarating. I mean, and I can't tell you how exciting it is when, as with your daughter, I see her working with her device, and I mean, I see the joy in her face, and that gives me joy. If I work with a laryngectomy who has lost his or her voice, and I fit them with a prosthesis and they get their voice, you can see the joy in their eyes. The joy and the tears from family members. And when that happens, I frankly do a happy dance. It's just an amazing thing. So I think that pretty much sums up. I am passionate about a profession that gives me joy, and it gives me joy every day. So, well, sometimes bigger joy than others, but mostly is joyful. As far as what students can look forward to, I would say the best thing that you can do outside of school maybe is to find some volunteer situations where you can be helpful to others, and then you can decide whether you want to be in a helping profession. It would be unfortunate for you to go all the way to school only to find out you say, wow, I don't really like to help people. I'd rather do something else. But I think having volunteer situations would be a good thing. When I went to school, and we didn't do volunteer work, but we did practicums where we went into hospitals, schools. That was mostly where we went, is hospitals and schools. It gives you a wide experience, and you begin to discover what it is that you're interested in. Some students come to us thinking that they would only like to do pediatrics, and find out that working with adults is also interesting and rewarding. I would also say to your students that it is a challenging profession to go into, and you need to be good students, work hard, get good grades. It is competitive getting into graduate school, but it's definitely worth the effort. And there is financial assistance for people who go on to graduate school for those things. I know one of the big topics of discussion is how people are dealing with student loans. And it is a concern, but you're also getting into a profession that is very worthwhile, and you would eventually get out from under your student loans. But it's a profession that's really rewarding and ever expanding, and gives you enormous opportunities.
Well, thank you, Danila. We appreciate you on here, and that was beautiful advice I think you gave to everybody, and a beautiful testament to your to speech pathology as well. So thank you for being on, and we hope that this was this was very helpful to anybody that's watching. Thank you.
Well, I do hope that it was helpful, and I really appreciate the opportunity to talk about something I really love. So thank you.
Of course. Thank you, everybody. All right, bye.